This is gonna look so amazing. I'm so excited to do this. Thank you. See you in a few minutes, okay? Welcome to the OR, guys. It is time for top surgery. Look over here. Remove the tissue, remove the nipple, liposculpt, new chest with nerve connection. Why? Sensation's important. Watch how we do it. All right, friends, we're starting with liposuction. We're gonna lipo the lateral chest. We go gently going with our cannula, and we remove the fat. And we're removing the, best to remove the dog ears on the side. All right, friends, we're gonna make our incision now. And we're using an electric cautery for our incision today. Put the other side. Okay, now we're gonna sculpt. Fantastic. Then we tuck that in to apply some pressure. Work on the bottom. We have a blood vessel that's bleeding. We have two. Sometimes on higher volume patients, we have more blood vessels. So first we'll get this one. Have to grab it exactly. Good. Now we'll get the other one right there. That's how you do it. So we have our nerve identified, it's right here. We're gonna tag it with the suture to do our neuroraphy, so we continue working. I put a suture and we'll come back to connect it to our graft. Our tissue is off. I always start with the ends, so I minimize any dog earring. Put the ends together and get them nice and tight. Friends, we've measured the nipple position from the midline, from the xiphoid, from the sternum. It's right there. Now we're gently going to remove the skin and we'll do our nerve connection. Now we're gently removing the skin and we're going to connect the nerve here. And now that we delivered our nerve through here, see I'm grabbing the suture, not the nerve. We're gently going to suture it in multiple points and then connect our nipple.
Alrighty guys, we did it. We just did a chest reconstruction for this lovely patient. We made the tissue smaller, made the nipple smaller for a flat chest. Let's go take a peek. Wow, so flat, nipple smaller. We did it.
Patients, are we doing it well? Or do we have any difficulty due to the throat soreness or anything?
No, it's been just fine.
Okay, awesome. Drinking tons of water and all
Yep.
that. Beautiful. So we're gonna take a look today. We're gonna open the compression, take a look at how your incision is healing, and then if there are tapes covered in your incision, we're gonna take those off too. And yeah, we'll go over everything for you. Okay? You ready?
Mm-hmm.
We like to instant release of pressure. Okay? You look amazing. Okay. Take a gentle feel if that's okay.
Mm-hmm.